There's no cure for ankylosing spondylitis, but with the right medication as well as lifestyle changes, patients can have relief of symptoms and actually prevent any worsening of the disease. The first line of treatment, or even for milder disease, we would recommend NSAIDs or non-steroidal anti-inflammatories such as ibuprofen or Aleve or naproxen. And these can be very effective in improving stiffness as well as pain. If individuals are not able to tolerate those or did not show good response, then we have other agents such as biologics. Biologics used include anti-TNF inhibitors. TNFs are actually found in cells that cause inflammation. Some are injectables, some are infusions, depending on what you need. The other biologic is actually interleukin 17, which is a cytokine that also causes inflammation, and it was recently approved for ankylosing spondylitis in patients who weren't either able to tolerate anti-TNFs or didn't have good response to them. So along with all of this, physical therapy as well as exercise is really crucial. And a good regimen with physical therapists as well as your rheumatologist can really help you ease some of the tensions and pain when it comes to the stiffness of the joints in the back. Stretching exercises that can help with the flexibility and mobility of the spine are key. Oftentimes, the morning is the worst in patients with ankylosing spondylitis, so starting off doing some stretching exercises can set you off pretty good for the rest of the day. Along with stretching exercises, swimming can be very helpful because it really uses multiple joints and helps with flexibility of the back as well.
Surgery wouldn't be necessary in the initial early stages of the disease. So a younger man or a younger woman wouldn't necessarily need to go right to some kind of joint replacement surgery or spine fusion surgery in the initial stages. But as the disease progresses and as patients get later in life, what can happen is that the bones can fuse together in a position that's not optimal. So in the case of the spine, if the bones fuse and the patient is leaning forward, it's very difficult to go about all of the daily activities of life if you don't have good posture and you're leaning forward. And at a certain point, it becomes difficult to do those activities of daily living, to enjoy life, and they come to a decision that surgery might be necessary. And surgery usually involves straightening the spine. And so, because the disorder can ankylose the spine and lock it in place, the spine often needs to be cut to reset it, and then screws and rods are positioned to maintain that better position for the spine.
If you have a diagnosis of ankylosing spondylitis, you can still live a very healthy and functional life. We have much better understanding of diagnosis and treatment today than we did before, and there are other medications being studied, especially biologics for ankylosing spondylitis and other inflammatory arthritis as well.